Hi, I'm Jen, a registered nurse and the CEO of Experience Professional Care Solutions. If you've ever tried to figure out the difference between home care, home health, and hospice, you know it can feel confusing and honestly a little overwhelming. Understanding these services is one of the most important things you can do to keep a loved one safe, supported, and comfortable at home. So today, I'm going to explain each one and help you see how they can work together to create the best care possible. Let's start with hospice, because this is the one families usually have the most questions about. Hospice is covered 100% by Medicare. It's for individuals who have a terminal diagnosis and are focusing on comfort rather than cure. To receive hospice services, a physician must certify eligibility. Hospice offers a beautiful range of support, not just medical, but emotional and spiritual as well. Hospice includes pain and symptom management, nursing support, medications and supplies, medical equipment like hospital beds or oxygen, social work, spiritual care, volunteer services, and even bereavement support for the family. A lot of families ask about the difference between palliative care and hospice. Palliative care can begin at any stage of illness and can be provided alongside a curative treatment. Hospice is specifically for the final phase of life, when comfort becomes the priority. Both focus on quality of life. They just serve people at different points in their journey. Hospice visits happen a few times a week, and there's always a nurse on call 24/7 if the situation changes. Next, let's talk about home health. Think of home health as medical treatment brought right into the home. Home health is covered by Medicare and private insurances. Home health does typically require a physician's order. There needs to be a medical reason, something like a hospitalization, surgery, illnesses, or a decline in mobility. And the services themselves are clinical and specialized. Home health may include things like skilled nursing, physical therapy, occupational therapy, speech therapy, wound care, medication education, and other doctor-prescribed treatments. Home health professionals typically come a few times a week for short, focused visits that are goal-driven. Now let's talk about home care, the service that families often need the most but understand the least. Home care focuses on daily living, comfort, and independence. It's non-medical, which means it's not covered by Medicare, but it is accessible to anyone who needs support. Home care is typically paid for privately. There are no eligibility requirements for private pay. You can start anytime. Some families also use long-term care insurance, veterans benefits, Medicaid waiver programs, depending on the state, but each of those do have their own eligibility requirements. Home care supports the everyday tasks that help someone stay safe and independent at home. This includes bathing and dressing, meal preparation, light housekeeping, medication reminders, mobility support, transportation, companionship, safety supervision, and respite care for family caregivers. One of the biggest advantages of home care is flexibility. You can receive just a few hours a day or full 24/7 support. It adapts completely to the needs of the individual. Now, here's where everything really comes together, because families are often surprised to learn that home care, home health, and hospice aren't competing services. They actually work really well together, in addition to, rather than instead of one another. Home care and home health. Home health provides short, medically focused visits. Home care fills the spaces in between. So if someone is receiving physical therapy or occupational therapy, caregivers can help them safely practice their exercises, support mobility, prepare meals and assist with bathing, and reduce the risk of falls. Help them conserve energy so they can participate in those rehab efforts. It's the everyday consistency that helps people heal more effectively. When you combine home care and hospice, hospice provides the medical, emotional, and spiritual support, while home care provides the hands-on, daily presence that hospice isn't designed for. Home care can support a client by helping them with personal care, providing companionship, maintaining a peaceful, calm environment, assisting with meals, increasing safety and supporting the family so that they can get some rest. Together, hospice and home care create a compassionate, complete circle of support. Home care also works wonderfully on its own, especially when someone simply needs help with daily tasks, early memory support, safety, or companionship. There's no eligibility, no delays, just support when you need it. Understanding the differences between hospice, home health, and home care is empowering. It helps you make informed decisions. It helps you advocate for your loved one. And most importantly, it gives you options. Hospice brings comfort. Home health brings medical treatment. Home care brings daily safety and independence. And when they come together, they create the strongest, safest, and most supportive care plan possible. I hope this helped bring clarity, confidence, and a sense of direction as you explore your options. If you ever have questions, we're always here to help guide you. Find us at experiencecaremt.com.